Mr. Chairman, there are 5 important variables that may be attributed to the success story in the containment of Ebola in Nigeria. First, when the first index case was confirmed, that Mr. Patrick Sawyer, American with Liberian descent, who flew into Nigeria on the 20th of July, we, or the President of Nigeria, immediately declared a state of emergency or national emergency and mobilized human, financial, and material resources to contain the outbreak. The President summoned a meeting of all the 36 state governors in Nigeria and discussed the way forward, the strategy to contain the disease. Luckily enough for us, the Liberian flew in to Nigeria by air. So he landed in Lagos, and Lagos being the most populous state in Nigeria, which luckily is one of the most developed states, had all the facilities. So he was sadly rushed to a private clinic with the best of facilities, but unfortunately he came too late for him to be saved. He died 5 days after. So as soon as he died and the declaration was made by the President, all resources were put in place. 1.3 billion naira was released to both Lagos State and other states to prepare for the eventualities. And all those who flew in with Patrick Sawyer on that plane, 34 passengers, were traced. They were quarantined. Those who were found not having the disease were released after some few days, some after 21 days, the incubation period. Secondly, the Federal Ministry of Health, in conjunction with all other states, were also mobilized. Ebola Emergency Operations Center was established with all the facilities and the equipment to trace those who came into contact with Mr. Sawyer. In fact, 8, as of today, 8 fatalities were recorded. That means Sawyer plus 7. And most of these 8 who died are mostly in the medical personnel. There is a protocol officer from ECOWAS who received Mr. Sawyer at the airport. He also died. He's a civilian. But majority of those 8 that died, unfortunately, were medical personnel who came into contact with Sawyer and those who had indirect contact with those who came into contact with him. Thirdly, Nigeria has a vibrant integrated disease surveillance response network, because even before the break of Ebola in Nigeria, we had a team that checks on polio. Polio is another disease that has been on in Nigeria, and we have a response team to polio. We had a response team to Lassa fever. So we built on the experience on that to deploy the personnel to contain Ebola. Then fourthly, apart from the government efforts, the private sector also played an active role. Years of corporate social responsibility activism that began in the Niger Delta paid enormous dividends. Companies like Dangote Group donated 152 million to support the federal government efforts. Other companies like Elemolu Foundation donated 50 million. Indigenous companies also contributed 50 million naira. Total, Shell provided utility vehicles, electronic fuel vouchers, and medical supplies. Indeed, Ebola was sadly contained with the support of the private sector family in Nigeria. The last case of Ebola was recorded on the 1st of September 2014, which tested negative, and the person was subsequently discharged on the 7th of September. 42 days after this date, Nigeria expects the World Health Organization to declare Nigeria free of Ebola. That's 3 days from now. Although the outbreak may be declared over within our borders, we must remain steadfast in our vigilance. As long as Ebola continues in Liberia, Sierra Leone, and Guinea, there is always a threat to our public health system. As such, we must continue with our active surveillance screening at all points of entry and exit, as well as increase in public awareness around the Ebola viral disease. In order to mainstream the momentum, the federal government of Nigeria has set up a scientific committee domiciled in the Federal Pharmaceutical Institute, which is based in Abuja, with some scientists to work on the some probable findings and collaborate with world pharmaceutical centers to see if they can get some, since up to now there is no cure for Ebola, to see if we can come up with a cure, either vaccine or drug for Ebola. So federal government has invested a lot in that, and there are scientists that are working on that in Nigeria right now. Nevertheless, our joy is subdued by unfolding tragedies within the 3 hardest hit countries in the sub-region. Nigeria continues to empathize and sympathize with the families, friends, and colleagues of those who had passed away following EBD outbreak. In spite of our recorded success in Nigeria, we cannot celebrate considering the record of death, of human suffering among both brothers and sisters in Sierra Leone, Liberia, and Guinea. Surely Nigeria will not rest on its oars until the West African sub-region is totally eradicated of EBD. Our President, President Jonathan, at the 69th session of the General Assembly, remarked, and I quote, "While Nigeria was able to respond effectively to control the spread of the disease, the situation in Liberia and Sierra Leone requires sustainable collective global action to contain. Through the concerted efforts of our healthcare professionals, the World Health Organization, and our international partners, we have been able to contain the EBD, and we can confidently say that Nigeria is today Ebola-free. In solidarity with our sub-region, whom we share a common destiny, Nigeria had provided $3.5 million to the ECOWAS Fund for the control of the disease and to the 3 affected countries, as announced by our President on the 12th of July 2014. That means 6 days before the arrival of Ebola into Nigeria, Nigeria made this commitment and redeemed the commitment of $3.5 million. We didn't know 6 days after we also have Ebola in Nigeria. These monies were distributed as follows: Guinea, Republic of Guinea, $1 million. Sierra Leone, $500,000. Republic of Liberia, $500,000. West African Health Organization, $500,000 to build capacity. And the ECOWAS Ebola Fund, which has been established by ECOWAS to work on the eradication of Ebola, $1 million. These monies were redeemed, given to the organization of the countries. In addition, Nigerian government has concluded arrangement to send volunteers from different professional bodies, that means health bodies, up to 591 to join the international force in Liberia, Sierra Leone, and Guinea to help or to assist in the fight against Ebola. While Nigeria continues its surveillance strategies, different measures have been put in place, including training of teachers, screening children, and educating parents on prevention of the disease. Meanwhile, the Federal Ministry of Health has ordered 3 mobile laboratories which will be used in other parts of the country as part of the measures to contain the virus. Let me conclude by acknowledging the support being provided by the African Union for the solidarity, in particular for the formation of African Union support for Ebola outbreak in West Africa. Our thanks and appreciation also go to our EU partners, the United Nations, that has set up United Nations Mission on Ebola Emergency Response in Ghana, the U.S. Center for Disease Control, World Health Organization, UNICEF, Medicine Sans Frontières, Red Cross, and many others that we cannot mention here. Now, it is time for global action to mobilize resources to support and comfort countries still affected by epidemic. It is pertinent to mention here that no country is free from the threat of Ebola until countries in West Africa become Ebola-free. I thank you all. Thank you.